Hi, I'm Amy Smollers. I'm CEO of Strategic Market Insight, and I work with professionals to define or redefine their value messages so they can be heard by their target audiences, understood, and embraced. Thank you for taking the time to watch this video this afternoon because I'm very, very excited to be participating and leading a workshop on Tuesday, May 19th in Philadelphia for medical affairs organizations. I wanted to point out 3 main things that you will walk away from by attending this workshop. The 3 things are leverage, seek, and evaluate. So what do I mean by that, and what will we do in the workshop, you're wondering? As part of being in medical affairs, it's really important to develop and nurture your relationships, not only with your own colleagues, but also with those in other departments, specifically pharmacoeconomics and HEOR groups. Now, I know historically from my almost 20 years in healthcare and experience and working in various areas of the healthcare industry, it's not always easy to develop or cultivate or maintain those relationships. So I'm blessed to have 2 other folks with me at this workshop. Rudy Christensen, who's Director of Health Outcomes and Value Assessment at Pacira Pharmaceuticals, and Terry Livingston, who's Senior Director for Medical and Value-Based Outcomes in Biogen. And they are going to be there to share some case studies, some of their experiences, what's worked, what hasn't worked, and how you can learn from them, and also to hear your stories as well, and how you can learn to better leverage those relationships. In terms of seeking, a lot of buzzwords around patient-centeredness research, and people are saying that they're doing patient-centered research. And a lot of folks are doing that. But I think one of the points of this particular workshop is talking about how do you assess your values in patient-centeredness, and then how do you reach out to and develop collaborations with other organizations who are like-minded and have similar goals and similar missions of doing that patient-centeredness. And so that's one of the other things we'll talk about. Number 3 with evaluate, it's not evaluating how well a program is running. It's not evaluating how the information is being interpreted. That's a whole other 1 or 2 day workshop. But in this particular one, the 3rd point is evaluating the timing and ways to engage with advocacy groups and nonprofit organizations. Now again, in my experience, either my clients or I have close friends and colleagues who work in the area of nonprofit or advocacy groups, there are ways to engage and reach out, and there are ways to not do that. And so in this portion of the workshop, we'll again hear from Rudy and Terry about ways that they've successfully reached out to some of the advocacy groups or nonprofit organizations. And I'm going to be presenting some process and templates that you can use to think about the timing and ways to reach out to these groups. So I will just say now, if you're the type of person who just wants to come to a workshop, listen to some information, and then go back and doing the things the same way you've always done them, this is not the workshop for you. However, if you want to learn from your colleagues, learn from other experts, practice some of these pieces, because we will have small breakout sessions, so you will have to practice and learn things that you can say to develop that give, take relationship. This workshop's for you. So please take a moment. There's a link below from the information that I sent you with this video that is the link to the actual website for the summit. You can get some information there. And also don't forget, you can easily reach out to me, Amy Smollers, with specific questions that you may have, and I'd be happy to answer them. So thanks so much for taking time to watch this video, and I look forward to seeing you in Philly. Have a great day.